Good morning, everyone. So if we can go to the first slide, before we get started sharing some of our experiences with you, we'd like you to just pause and reflect on these two questions. When you think about looking for information about your health on the internet, do you know where to look? Do you know how to look for it? When you find information, is it written in a way or is it presented in a way that makes sense to you? And do you trust it? Do you have a sense in yourself that the information that you're reading makes, that it comes from a credible or reliable source? So what we hope to cover for you, this is our goal in the 9 minutes in which we're allotted, is some of the benefits and burdens, some ideas about how they're helpful, some ideas of how to choose what is right for you. When you're accessing e-health resources, does it change your relationship in any way with your care providers? A few tips for success, and then we'll open it up to some questions. So moving along, some of you might be able to relate to this picture. This poor donkey's got a lot of weight that it's trying to carry. So let's look at this in a little bit more detail. First of all, as far as benefits, when you're access information, whether it be on the internet or elsewhere, learning more can give you an experience of whether your experience is typical. Are there other patients who are also experiencing the same thing as yourself? It can provide you with information on relative risks and benefits of different treatments. It can be very empowering, and we can, with the different kinds of information on the internet, such as blogs and things where you can exchange information, you can learn from others. It helps you to prepare your questions for your interactions with your healthcare providers. So I use it as a way to say, okay, I know I have an appointment coming up in a few weeks. What are the issues that I want to discuss? So I can be prepared in advance so that I have better questions so I can use that time more effectively. I also find that when I get information that I'm confident about, I feel more confident about my decision makings, whether I'm going to stick with this drug, move on to a different drug. I feel more confident in my decisions if I'm confident in the information that I'm making that decision from. It can help to relieve worry. So I can be concerned, for example, about the side effects of a potential medication. And I can read up more on it and find out actually that those side effects are relatively rare or they're very easily managed. So I can feel that it helps to relieve some of my worry. Conversely, you can sometimes feel some burdens associated with looking for that information. Sometimes when you learn more, it's a little bit more scary. There's some information there that makes you feel more uncomfortable. It also takes time to find that. And we also know that sitting around isn't all that great for our joints when our joints are sore. It can become a bit of an obsession if we're not careful. It takes some skills, it takes some practice to be able to find that information. And sometimes we're concerned about whether it's trustworthy information. It can also help to create some worry. So I might not have been aware of a particular side effect, and then I read it as a potential, so it can create some worry. So these are the kinds of things that we balance when we're looking for this information online. So now I'm going to pass over to my esteemed colleague, Sharan.
Hi, everyone. So as Alison introduced, I'm going to talk to you a little bit about how helpful these e-resources can be. First, one of probably the best things is that you can view them when you want. Speaking from experience, I see my rheumatologist every X amount of months, and there can be a lot of pressure to prepare for that appointment. So one thing that I've found extremely helpful about looking at information online is that it's there when I want it. I don't have to make an appointment. I can just grab my smartphone, a tablet, a laptop, and I can start reading about something that may have come to my mind. You can also view this as many times as you want. So again, speaking from experience, sometimes there is pressure to ask certain questions and to get certain information, and you might miss something that your physician is telling you, or you may have forgotten to ask something in the shuffle of an appointment. And you can also view it in the way that you want. So all of us absorb information very differently. Some of us are more auditory or visual. We like to replay things. We may prefer to just read something. We may like an interactive medium. And looking at things online gives you the freedom to select how you absorb information optimally.